This poor little kitty came into the clinic after it got caught in a fan belt. Getting caught in a fan belt can be very dangerous for cats and can cause big cuts, and can even have cats can even lose a limb or be cut in half when they seek the warmth of an engine, and then when it starts, it's a bad situation. So this kitty just had head swelling and edema, and I'll show you some of the signs it had. It's a cute little kitty. If you look in the eye, you'll see that the eye is a little bloody, the membranes are bloody, and the eye and the pupil itself is fairly dilated. Now this eye, the pupil is very constricted. Let's see if we can see that. It looks like a snake, doesn't it? See that little tiny pupil? So that's a sign of unequal pupils. A sign of unequal pupils shows that the kitty has a swelling in its brain and maybe a concussion. So, and another sign I'll show you in a minute. So basically, when any animal gets caught in a, say, fan belt or traumatized, you kind of look around, see if it's breathing okay, the chest moving up and down. You check its gums and see if they're pink, if there's oxygen being delivered to the tissues. They're nice and pink. Is there any wounds in the mouth? Well, she doesn't want to let me show, and she doesn't want to. She's painful, so we're not going to worry about that right now. Then you look all over their body to see if there's any cuts, any other cuts. I know, sweetheart. Is there any cuts anywhere else in the body? Any bleeding wounds? Is there any broken legs? You can feel the bones and you can feel the joints. So the joints in the front leg are okay, and attached to the shoulders okay. Same with this leg. The pad's okay. The wrist bends, the elbow bends, and the shoulder bends, and all the bones feel pretty solid. They're not dangling. Same with the hind legs. Pads and the feet are okay. The hop joint's okay. The knees, the stifle's okay, or that knee joint, and the hip joint up here. So okay, so you feel all the bones and all the legs. Look for wounds. Look for the blood. And how's the cat acting? Is it acting normal? Well, I'll show you what this little kitty's doing when you put it down on the ground. Now, it's looking around towards the noises, but when you put it down, it goes in a circle. That's because its brain isn't working very good. It's circling, and that's a sign its brain's not working too good because it's got swelling in the brain. Now, a lot of people would think this cat would be easier to take care of, but that's me, because it's not going to go anywhere. You have to put... I'm not even going to talk about that anymore because that's me. But anyway, so how can we help this little kitty? Well, we help it by reducing the amount of inflammation in its brain with some things to take away swelling and pain. I know, sweetheart. I know. So we're going to help it out by, we're going to try to take away swelling and pain and see how it does. But you could tell, even though it was circling, it was using all of its limbs, and it was keeping upright. So it's aware of its balance, and it's able to use all of its legs, and its tail was moving. So you know all those connections are there. It's just the connection, the balance is out of whack. And so as you keep the cat nice and quiet, and it doesn't have to get its brain going to initiate movement, it's fine. So it's nice and quiet here. But the minute it has to do something, its brain's telling him that it's got to go in one direction. But now he's actually feeling a little better now that he's quieting down. And when he gets agitated is when he'll start to circle. But as long as you comfort him, sometimes it's not so bad. Kitty, come here, kitty. But you see, he's answering me. So that just shows you again that he knows what's going on. Kitty. See? He says, what? I'm circling. Do something. Help me. Quit talking about it. Okay. Well, here's our little kitty after a few hours, and it was circling pretty pretty tight turns and he wouldn't stop circling. And the eyes, as you remember, were somewhat closed. Now this eye, the pupil's pretty dilated, like it was. And then this eye, the pupil's starting to not be quite as constricted, but still is pretty constricted. This eye was bleeding and it stopped bleeding. And you can see the wound on the head, the abrasion. Kitty. This little kitty is pretty quiet when you hold it nice and quiet, and seems to know where he is. And he's when he talks back to you, so you know he's conscious. You say, "Hi, kitty, kitty, kitty." He goes, "Yeah, like here I am, like fix this, like yeah, fix this." And he can walk on all fours. So he can keep his balance, but he's just circling. And like I showed you before, but now he's taking bigger circles than he was. Actually, that's tight, but now when he circles around me, so he's still circling a little bit, but if you put him around me, he will circle around me like this, so he can certainly navigate things, and he can stop now. I know, it's tough to have a concussion. And so he kind of sticks to you because he's thinking, he feels good when the side of him he feels he has to go to is up against something. So that's why he just sits there. Huh? Do you just sit there? Yeah, just sits there. Do you just sit there? Yeah. I know. It's tough to fight the urge to circle. So he just circles around that area. Here he comes again. Like a little Christmas train. But we're hoping he stops doing that in a period of But he's stopping now, and he's able to control himself. And he's actually going, well, that's pretty good, see? He's kind of going straight, so his brain is starting to kind of retraining his little brain to get around the injury, the swelling going down a little bit. But he knows where he is, and sometimes you think, oh, that poor cat's suffering. Suffering means constant pain, laying on their side, not being able to put weight on one of their legs. But this little guy just needs to figure out swelling has to go down the brain, and so he can figure out how to get better, huh? I know it hurts. I know it hurts. I know it hurts. I know. I know it hurts. I know.
There you go, Sharon.
Okay, so we'll let him rest. Rest is good for everybody. Well, I hope you enjoyed watching the little kitty. It is a cute kitty, and I wanted to let you know that it did stop circling as much and started to go a little straighter and went home. I did use a little bit of cortisone and antibiotics. However, cortisones are contraindicated in major head trauma. They actually make the signs worse, or the outcome worse in the long run. But in this case, I thought, this little kitty's getting better, and I used a real low dose and for pain and also for a little bit of the swelling around the face and the eye, and thought that would work out well. You can see that this little kitty started to feel a little better about 3 or 4 hours after the injury, and went home that night on some antibiotics and some pain relievers. So I hope that everything is working out. Check out my book, Dog Dish Diet, and because it's got some great tips for educational nutrition. What I try to do is teach people how to feed their animals better. There's a free, not a free, but there's a download slow cooking PDF there if you want to cook for your dogs. And I am coming out with another ebook, small ebook called Feed Your Pet to Avoid the Vet. And it will have some feeding tips for dogs and cats, as well as show you how you could slow cook for your dog with various recipes in it, and actually kind of focused on problems that they may have that it may help. And also have a lot of feeding tips for your cat too, and some possible recipes you can use in trying to slow cook for your cat. Cats are really finicky, so it's hard to get them to eat what you want, but I have some ideas for you in the book. Anyway, have a great day. I hope watching this video was interesting to you. Don't feel too bad for the kitty. I'm sure it's doing fine. And you have a great day. Spring has come to California. It's really nice.